I'm back. You all can read the biography materials that are listed there. There are a couple of things within the context of my career that have been pivotal in encouraging me more towards an advocacy role and an educator role, and sometimes a pain in the ass role. But that's what sometimes you gotta be. I've worked at UAB for 25 years. I ran the mental health center there. I'm now working with NAMI National as their associate medical director. But probably one of the most pivotal things in my life is I'm a family member of 2 people with serious and persistent mental illness. And when you live on that side of the equation, it changes how you interpret the other side of the equation. I worked as a federal court monitor, monitoring the progress of the Department of Corrections in improving mental health services for women at Tutwiler Prison. That was an eye-opening process where I learned really that for the most part, I think people who are providing services, mental health services, are well-meaning, good-hearted people, but typically they're under-resourced and undermanned. And when those situations happen, bad things happen. So one of the things that I think we've talked about today is that we need to have sufficient resources for those who are providing services so that they can function in a maximal fashion. I also worked with the Department of Justice as one of their investigators of the state hospital system over in Georgia, which was eye-opening because I had spent some time kind of looking at the mental health system here we had in Alabama, and you know, usually we say thank God for Mississippi. I'm saying thank God for Georgia because it was very eye-opening to see, again, good-meaning, well-meaning, good-hearted people who wanted to provide maximal quality services but couldn't because they were understaffed and under-resourced. So this has kind of been one of the themes I think we've talked about today. I predict that everyone here is here because they either have a mental health challenge or mental illness, or they have a family member, or they are involved in providing care and service to those people. And we are all well-meaning, we are all good-hearted. We have to figure out how can we mobilize the resources that we need to ensure that people who have mental illness can live with their mental illness in a quality life. The things that I've learned today, the major themes that have jumped out at me today, I predict have just jumped out to you as well. One of the major ones is I think we need to have a system of care. What we all do, and it's human nature, is we live in our silos. You know, I'm focused on providing care. I'm focused on doing this from day to day. Jimmy works in the court system and with the jails, and we all have our small silos. The problem with that is if we are not talking with one another, if we're not working together, per Sam, if we are not working in partnerships, then we're not going to do our very best work. So that everybody is here today and is spending the day here tells me that we are committed to working in partnership. Now, the first time I got involved with Susan Beatty Pierce and NAMI, we were working on it's called the Crisis Intervention Task Force because there had been a tragedy between law enforcement and a consumer. And that was when I was pregnant with my daughter, Sarah, and Sarah turns 24 in April. So this is not a new topic, but I feel like there is a resurgence of energy and commitment. That's another major theme today. People are beginning to understand mental illness is a biologic illness, and it needs all the wraparound services that somebody with a biologic illness has. Several times people today have said, well, if you have a heart attack and you come to the emergency room, you're not going to be told, we don't have a bed for you today, come back in 2 weeks. That doesn't happen. We have to understand if someone is flagrantly psychotic,